We're joined now by Dr. Ali Hassoun, an infectious disease specialist at Huntsville Hospital. Thanks for joining us again tonight, Doctor.
Oh, thank you for having me.
So, Dr. Hassoun, the biggest districts in the area, as you heard, decided to scrap the idea of bringing students back to the classrooms, instead go all virtual. Do you think this was the right move?
I believe it is the right move, especially with the cases continue to rise. You know, as we see widespread community infection transmission, we definitely, if we do face-to-face learning, we're going to have problems in the school with the transmission, and then the case is going to go up. I think pushing it that 9 weeks is going to give us a cushion or opportunity. If we work all together, we might be able to cut down on the cases, and if we cut down on the cases, so it's going to make it easier face-to-face learning, and then it's much easier whether on the parents, the teachers, the stress of possibilities of infection, everything going to make it easier if we can help reducing the transmission first.
When it comes to our youth, we've heard that teenagers and children are less likely to get the coronavirus. Is that really the case, or are they simply less likely to show symptoms?
So it's really, that's not the case. It's less likely to show symptoms rather than less likely to get the infection. And you probably heard there's been a study published through South Korea for children, and they were 10 and above, but they saw their rate of infection is similar to the rate of adult infection, but the symptoms was less. Now, we know for a fact in the United States the same thing, but also we know some of these kids, if they get infected, they can get severe problems, complications. So it might be a minority, but it can be a major issues for the kids.
And we reported just a moment ago that nearly a dozen districts in North Alabama will forge ahead with traditional learning, opening their schools for students with an option for virtual learning for those who want it. They cite kids' nutrition, parents who need to work, learning gaps, and overall mental health of students. These are all valid concerns. So where is the balance here?
Yeah, and you know, definitely these are concerns, and you'd really want all these aspects for the kids, for the parents to have it. But I think in a public health emergency like this, with a pandemic and risk to the community, risk to health of any individual, I think it gets to be where we need to think about reducing that risk first and work on others as much as we can till we get this under control better.
We reported just a few minutes ago that there will be fall sports for several school districts. Schools are going virtual, yet many districts are still allowing sports. So how can young athletes safely take part in these extracurricular activities?
Yeah, I mean, and I can tell you that's puzzling to me. I mean, if we really are trying to do our best to reduce transmission, and we said the schools should be virtual at least for the first, you know, or remote the first 9 weeks, I don't know how contact sport, initiating it now, gonna, you know, not affect the transmission. It's very difficult for young athletes, especially when they gather, whether in transportation, whether, you know, between each other training. You know, this is high risk of transmission considered in football as a sport. So it's very tough. You can put masking, you can talk about, you know, hand hygiene, physical distancing, but I really don't see how all that done, because all the sports who started, and a good example for the, you know, soccer overseas, or the Major League Baseball that they start. They have no spectators, they're gonna get tested on regular basis, they make sure nobody's infected, everybody who's positive not going to come to the facility or train. So there's a lot extra thing need to be done so you can do things safely. And I'm not sure if the football in Alabama is planning to do that.
Yeah, you kind of answered the next question that was on my mind, is what precautions can schools and coaches take? Is it that those steps that you just mentioned, and is there any way to play a contact sport in a pandemic?
Yeah, it's very, very difficult to play contact sport in a pandemic. I mean, I don't see it. You know, it's an upper respiratory tract infection. It transmits by secretion and saliva and droplets. And when you do contact sport, that's the easiest way of transmission from one person to another. I really don't think it's a good decision at the moment to do that.
What is your advice to parents if they have concerns that their youth athlete might have been exposed to the coronavirus and as they wait for those test results?
Yeah, so if anybody got exposed, the guidelines say you're going to need to get tested, and in the meantime, while you're waiting for that test, you need to quarantine yourself. That's really, really important to do. Till you get the test back, of course, the test needs to be done in the right timing. So we usually don't do the test immediately. We wait 5 to 7 days and do the test because it takes time for the virus to show up and shed as well. So in the meantime, these young athletes need to be quarantined, and at the same time, imagine whoever in close contact with them, the parents, you know, all these going to need to think about possibility of exposure, and that's going to complicate the facts more as well.